Assalamu alaikum, respected viewers. I'm Dr. Mohammad Ramzan Ansari, Assistant Professor of Pediatrics. This is a child with 1 day old child with history of delayed cry. Uh, ये इस बच्चे में एक साइन नज़र आ रहा है subtle seizures का, which I want to show you. The child is having lip smacking and abnormal blinking of the eye, up rolling of the eye, and has automatization. This lip smacking movement. This is subtle seizure. Child also has history of morning cry and was uh, resuscitated with positive pressure ventilation at the time of birth. Um, the child, in addition to this, had morning cry as well, and is slightly improving with in respect to his saturation and respiratory rate. Child is able to take oral feed but has grade 2 HIE. Whenever a child has grade 2 has seizure, this is called grade 2 HIE, hypoxemic ischemic encephalopathy.